My guest is Mr. Corbin Stanley. He's with the American Foundation for Suicide Prevention, and I'm going to do an introduction, and then he is here to give some more extensive background on what this issue involves. And I appreciate you taking the time to hear the testimony on a bill that is, I believe, of paramount importance and perhaps is maybe the most meaningful piece of legislation I think I could work on this year. You've heard before that suicide is a national epidemic, and Michigan's suicide rate has increased an astonishing 33% in our state over the last decade. You may think that you know a lot about depression, mental illness, addiction, hopelessness, and suicide already. However, you may be surprised to hear that suicide is not on the increase in every state like it is in Michigan. Here are some additional facts about suicide you may be surprised to hear. First, half the people who die by suicide have no diagnosed mental health condition. Half have not been diagnosed with any mental health condition. Second, intentional drug overdoses only account for 1/10 of the suicides. That's a big misconception that they're primarily drug overdoses. That's only 1 in 10. Third, in Michigan, there are more deaths by suicide each year than all traffic and gun deaths combined. These facts challenge a lot of assumptions about suicides. The fact that most people who die by suicide have no known mental health condition or drug addiction is not the story we are often getting associated with suicide attempts. The reality is that many of those who die by suicide are reliable workers, parents, seniors with no known mental illness. The realization, along with Michigan's sharp uptick in suicide rates over the last decade, underscores the need to do thorough researches on the causes and the demographics of those who attempt suicide in our own state. There's a lot of data we need to gather to turn things around. This is why I introduced Senate Bill 228. The bill will create a commission to study the causes and underlying factors of suicide in the state of Michigan, bringing together state resources to compile data and develop a statewide action plan. Under the bill, the commission will work with state departments, agencies, associations, corporations, nonprofit organizations to study the causes and possible underlying factors of suicide in Michigan. The study will focus on demographics showing the highest suicide rates in the state in the prior decade and the highest growth rates of suicide. The commission will provide recommendations for further data collection and a coordinated state approach to prevention of suicide. By January 1st, 2020, the commission would prepare and present a preliminary report of the findings and recommendations to the legislature. By June 1st, 2021, the commission would prepare an updated report and recommendations to provide a path for coordination of efforts statewide. Members of the commission will serve without compensation, and the commission will be dissolved once it accomplishes this coordination of suicide prevention efforts across the state. Since there are currently no coordinated efforts in the state to understand the risk factors, underlying causes, changing trends in suicide across the demographics, we need a commission to get to the root causes of the crisis. To be effective, the bill structures the commission to work in subcommittees. These subcommittees will be able to focus on specific demographics and to appoint additional members to their subcommittees. This will ensure that the work can be done effectively by bringing needed stakeholders on board. Just before I came in, there was a suggestion of perhaps creating an executive board to more streamline the numbers of subcommittees, at least initially. We have had enormous outpouring of concern from across the state that various groups are included, but we want to keep the commission manageable, so that may be something we will look at in terms of streamlining the number of subcommittees. Last year, I introduced this bill with overwhelming support. Most of you on this committee supported the same bill last term, and I thank you for that. As you may know, this legislation was voted out of the House. It passed out of the Senate Health Care Policy Committee last term. Unfortunately, we ran out of time during lame duck. My office has received a lot of support, including phone calls and emails, to push for this commission to be enacted this year. We have overwhelming support and enthusiasm to tackle this crisis in this statewide, all-hands-on-deck approach. I can't underestimate how important I believe this issue is. Establishing this commission through timely passage of the legislation is essential, I believe, to change Michigan's story when it comes to suicide in our state. Bringing everyone together in the state can turn Michigan statistics into a success story. Our state can be one of those listed with dropping rates in the future if we work effectively together. Now at this point, with your permission, Mr. Chair, I would like to turn the testimony over to Corbin Stanley to provide additional information. Thank you, Mr. Chair and committee members.